Let's go through grid keratotomies, shall we? Go on then. So grid keratotomies are very similar to a diamond burr in that they are used as a treatment for SCEDs, so spontaneous chronic corneal epithelial defects. Now, as a recap, these are chronic ulcers that are present in middle-aged to older dogs only. So emphasis on the middle-aged to older. If it's 1 or 2, it's not a SCED. Dogs specifically, this is not something that cats get, and they cause superficial ulcers only. So if it is deeper than superficial, also not a SCED. And these are ulcers that have been present for longer than a week, and we've just got to make sure that there is nothing else contributing to this or causing the ulcer at all. So dry eye, infection, anything rubbing from the eyelid on the cornea, so on and so forth. If you're not 100% sure, a slit lamp exam can be really, really helpful. So if referral is an option, wonderful. I will go into why a grid keratotomy or a diamond burr is only for a SCED and why it isn't really going to help if it's any other type of ulcer. We will get into that a little bit later. Now, just to preface this with, we don't recommend doing grids or diamond burrs in cats at all because there is a risk of them forming a corneal sequestrum, so the cornea kind of dying off essentially, and we just basically would be making the problem of their ulcer much worse. So we just don't want to do it in cats. Grids themselves have there or thereabouts an 85% success rate, so they do have a very good success rate. And when it comes to this versus diamond burrs, they're kind of the same if they're both done properly. Is that fair to say? So don't worry if you've not got a diamond burr. A grid isn't necessarily second best. So if we think back to the anatomy of a SCED and what's going on at a cellular level, in essence, what a grid keratotomy is doing is getting rid of that kind of blue layer we see. In reality, it's not blue, it's invisible, but it is this extra hyalinized acellular layer which is stopping epithelial cells from sticking down to the stroma. So whenever we're gridding, we're always going to do it with topical local anaesthetic on board, such as proximeticaine. Now, you can do these in a conscious dog if it's really well behaved. You can do it under sedation or you can do it under anaesthetic. I personally would always do them under sedation or GA. Maybe that's me being a wuss, but I don't particularly want a needle flying around a dog's eye. And we prep the eye first before we do anything else with 1 in 50 diluted iodine solution. And so when everything's nice and numb and clean, we cotton bud debride those loose epithelial edges. Now go back as far as they will peel. You can't peel off healthy epithelium. So if you're just peeling and it's coming, that's fine. Sometimes these ulcers are really big. You're not doing anything wrong. If you're doing it with a cotton bud, you can't do this bit wrong. All I would say is that cotton buds become moist very quickly, and so they lose their gripping ability. So you just use several cotton buds, make sure that they're as dry as possible, and then that's going to debride a lot more efficiently for you. And then using a 25 gauge, so an orange needle, attached to a syringe just because it's easier to hold it, you were going to make superficial, linear, and then horizontal hatched incisions that extend just into the stroma. So we're going just beyond the epithelial layer. Now, when we're doing this, hold the needle at a shallow angle, just so that obviously if you slip, the needle's not going to poke straight into the eye. And when we're making those incisions, we're kind of making them like 1 to 2-ish millimeters apart, and you're going just beyond the edge of the ulcer, how far you've debrided it back to. If the patient is under anaesthetic and obviously the eye has rolled down, you might need to use just very fine rat tooth forceps. If you grasp the conjunctiva at the level of the limbus, hoik the eye up, you'll be able to hold the eye up to actually access the ulcer. And it's going to look a little something like this. I honestly can't tell you how much joy making these animations brings me. They take me too long, but I have fun, and that is all that matters. So if we translate that into this is going to look like at the cellular level, cotton bud debride the epithelial cells away, and then the grid is disrupting just that hyalinized ice skating ring. And so this is just a little video to kind of show you should just be able to see the incisions. Then afterwards, we're going to send them home with a topical broad spectrum antibiotic, so something like chloramphenicol 4 times a day, just making sure that we're preventing any infection from setting in. Topical hyaluronic acid lubrication, honestly, most of them have hyaluronic acid in, most of the ones that your practice will stock. So whatever your practice stocks, basically. 5 to 10 minutes after you've put the chloramphenicol in. If it was a particularly inflamed ulcer, I sometimes give them either Stromies or serum, potentially instead of the lubrication, only from the perspective that often if they're really inflamed, the dog's normally really annoyed by that point, and so we've got to kind of cherry pick which drops we're giving. And of course these are painful, so we're going to give them systemic analgesia too. Average healing time is around about 2 weeks, depending on how big the ulcer was. If at that point there's not much difference, i.e. it basically looks like it did before the sced and the dog is acting like it did before, then we either need to consider repeating the grid or burr, or referring the dog if you can. Real life is going to look a little something like this. So I have numbed the cornea, we have cleaned the cornea with iodine, and previously I also specifically numbed that bit of the conjunctiva that I'm grasping with the forceps. And then we're just getting our dry, sterile cotton buds, and we are peeling any loose epithelium back. So I'm just grabbing a new cotton bud because, again, they peel so much better when they are dry. And I've sped this bit up because I feel like you get the gist, but ultimately we just keep on going until the ulcer doesn't peel back anymore. So this ulcer, you can see it's kind of stretching medially in a sort of U shape. They can kind of be any size or shape at the end of it, as long as you're happy that you've peeled it all back, essentially. Once I'm happy that it is no longer peeling back, we've peeled off all the redundant epithelium, I'm going to renumb it with proximethicane just to renumb those newly exposed bits of stroma. And then the grid itself, just honestly, it's a really light pressure. It's just a very gentle scratching. And as I said in the video, you can just see those little scratch marks on the cornea. So we're making sure we cover all of the ulcer. And then we go back on ourselves, basically. So we're going to make incision scratches perpendicular to the ones we just made. Do it across the whole surface of the ulcer. That's about it, really. So I hope that was helpful. Bye!